I'm Dr. Jonathan Amspacher, and I'm a board-certified plastic surgeon, and I wanted to take a few minutes to talk to you and answer some basic questions about something that we get asked a lot about, and that's breast augmentation. And so if you're considering breast augmentation, there's a couple of things that you really need to know about, key issues, and then in another video we'll delve into each issue a little more specifically. And so a general overview of issues are things that you want to think about before you even consider having breast augmentation. And so a couple of key topics start with incision location. And so the incision location is generally broken up into 4 categories. One category is the incision that can be placed on the breast itself, and generally that folds into the inframammary fold, which is at the base of the breast. Around the nipple and areolar complex is another choice, and 2 further away choices that some people use are in the axilla or armpit or around the umbilicus. And so we get a lot of patients that ask what incision choice is best. And so I like to think about it that the incision that gives you the most direct access to where you want the implant to end up eventually probably is the safest and most reliable option. And that's what we really want to achieve in surgery, is safe and reliable, because that gives you the best outcomes in the greatest number of patients. And so the inframammary gives a very good incision. Some people choose the areolar incision around the nipple and areolar complex. That's been safe and proven reliable, but it does have a slightly higher risk of capsular contracture in some studies. And so that's why we generally recommend the inframammary incision. The incisions that are placed further away, such as in the axilla or in the umbilicus, they have a little higher risk of malposition of the implant. And also I like to point out to folks, there's a lot of folks that will see your belly button or see your armpit, but there's very few people that will see your breast, and so incisions there are actually the best hidden for most general purposes. The other things that you want to think about is choice of implant, and so there's a lot of variety out there nowadays. We have form-stable implants, we have standard silicone implants, and we have saline implants. And so I usually break it up into saline versus silicone as a way to think about it. The silicone implants very frequently are the preferred option because they have a very natural feel and a little more common texture and similar to a breast. The saline implants, however, can be a very nice option. They offer the benefit of being a little more cost-effective, and they also have a little lower risk of capsular contracture, but they're a little firmer feeling, and they may have a little more visibility, especially in a thin tissue envelope. So for folks who have a very thin breast envelope or an A cup, then they might not be as good of a quality application of a saline implant, and so they would want to lean more towards the silicone. But there's not really absolutes in this, and so it's something that you want to meet with a plastic surgeon and discuss and do a little further research on to help you choose what will be the best option for you. The other question that I really like to think about is where to place the implant. Implants have been classically placed either just below the breast tissue or below the pectoralis muscle. Many studies have shown that when you place an implant below the pectoralis muscle, that it has the safest, most predictable outcome for most implant types. That being said, some of the newer form-stable implants may be a little more predictable in the subglandular or just below the tissue position, but I still think there's enough research data that usually patients are benefited most by placing the implant below the muscle. So here are a few things that you wanted to think about: implant position, below or above the muscle, type of implant, saline or silicone, and whether you want to go with an incision that's around the breast or off the breast. And so there's some basics that you want to look at, and we'll talk about in the future about other things or more in depth on these topics in particular.